Hi, I'm Dr. Julie Steinauer. Let's talk about a condition that we see a lot of in our clinic called esotropia. Now, esotropia is a form of strabismus or eye turn, and what that means is that an eye turns in, and there are a couple different ways it could exhibit itself. It might exhibit as a constant eye turn. It could be an intermittent eye turn, which means sometimes it's turning, or it could be alternating, which means that it flips between the two eyes. So one turns in, then the other turns in. Now, in esotropia, we can have this basically kind of early on, almost from birth, or it can be an acquired condition, which is happening a little bit later in life. Now, there are many different types of strabismus or reasons why you can develop strabismus. In the acquired kind of setting of strabismus and esotropia, one of the ones that we see an awful lot of is accommodative or focusing related. And we also might say it could be stress related because a lot of us these days are on devices up close. And so it's a lot more common today to see esotropia cases than what it used to be years ago. Now, we also break down esotropia by the amount of eye turn. So if it's severe and you look at someone, you'll never wonder, do they have it or not? You'll know for sure because that eye is going to be really turned in. If it's more of a moderate case, you might miss it. And the person could really be very adept at moving their head and kind of concealing the fact that their eye turns. They might be sitting in a position all the time, and you may never know it. The small angles and what we call microtropias or microesotropia, those are also ones you can miss those and not even see those at all. So with all this talk of like angles and degree of eye turn, what do you do about this? Is there a form of treatment that's successful? In our clinic, the answer to that is yes. So we treat esotropia two different ways. The first way is that we use photosyntonic or syntonics light therapy goggles that electrically trigger the brain and send signals directly to the muscles of the eyes that kind of tell the muscles what they need to do for realigning the eye. So if someone has a problem where they're turning their eye in, as in esotropia, we can kind of use a specific filter that triggers the muscles to say, hey, let's relax that eye. We don't need to cross it in nearly as much. And so one form of treatment is kind of the electrical stimulation of the brain, trying to train the brain what it needs to do. And the second form is going to be a bit more motor or mechanical, where we're training the brain in a process of kind of repetitive activities about how it needs to align and use the two eyes together. Now, this is a really watered down approach to what we do because there's tons of other things that we use in our treatment of our esotropic patients. And there's really not an angle that's too small or too large for us to deal with. We have dealt with some really large angle eye turns and had really great success. Now, if you want to learn more information about how we treat esotropia, or if you want to see some information about like what are the success rates that could possibly go on with this, you can go to our website at visionforlifeworks.com. We've got a lot of success stories there. We have to be very cautious in posting pictures, but we do that from time to time when we get permission from our patients, and obviously always protecting their information and sharing only when they allow us to. But go to our website at visionforlifeworks.com. You can check out more information about what we do to treat and manage different types of strabismus. You can also fill out a form there that is a questionnaire form, and that sends kind of information over to us if you'd like to learn about how you could be a patient in our clinic. Now, if you're local to us, just call us. So call us at 618-288-1489. Thank you.